I couldn't agree with you more. I'm gonna tell everyone. I wasn't gonna share this with people, but I feel like this is the time to say it. Hello, guys. So today we're gonna have a very interesting interview with a lady called Dr. Erin Jones. Yes, a medical doctor, and she's going to be chatting about her business called the Health Hopper. It's a startup business, it's brand new, and she's trying to get it off the ground. And there's so much happening over here. It's a female doctor trying to start her own business, and not trying, she started her own business. And I think it's a crucial service she's providing. I think it could help you guys. She provides medical services, so like a house call to people in Cape Town, and she also provides virtual consultations, and she explains exactly how that works, because this business came on after the pressures of COVID. She's a very seasoned professional, so just check it out and hear what she has to say and listen to the Health Hopper a little bit. And I also share a bit about my own health struggles, and I share a little bit of personal information at the end that I don't think you guys knew anything about. Well, you definitely didn't know anything about because I didn't share it. But have a look, watch this, and just, this is a startup business, and I think it's gonna boom. And yeah, just have a look, you'll see what I mean. Are you ready? I'm gonna count us down. 3, 2, 1. Hello! So, like I said, I was going to chat to the Health Hopper, Dr. Erin Jones. And the reason I'm speaking to the Health Hopper is because she's extremely interesting, and I think that she gives a unique and vital service. So, hello, Dr. Jones. How are you doing?
Hello, Alfred. I'm well, and you?
Fantastic to have you. Thanks for coming on, because I was like, it was chaos, but I knew I wanted to do this. And I just appreciate your time, because obviously, as a doctor that visits homes, you must be on the road and busy, right?
Yes. No, we are picking up now, and definitely are getting busier. So.
Yeah. Okay, so the idea around the Health Hopper is this. Let me just explain what I understand. Dr. Jones is basically taking it back. Remember when people, well, not in my lifetime, but people used to have house calls. There were like a few house calls I saw with my granny back in the day, but a house call isn't a thing that we have anymore. And now with COVID, both my parents need to go and see the doctor, but they've been so nervous to go to a hospital because of the horror stories. So I thought it was a vital service that you provide, and I thought I needed to speak to you about it and ask you. The first question I want to ask you, because I know that is the first thing that will come to my mind. Are you a doctor, or are you someone that is a medical doctor? I don't want to disrespect other people, but I'm just saying, did you go to med school? Is it an MBCHB? That's what I want to know.
Yes, an entire MBCHB, 6 years of MBCHB, and sweat and tears and everything that you can put into that 6 years was there.
Oh my goodness. Where did you study?
At Stellenbosch University.
Oh, it's Stellies. And when did you finish? What year you finished?
In 2012. Yeah, 2012.
Oh, that's like 9 years of being a doctor. And then what's your history? You know, when you say 2012, you know what scares me is that I finished university. My first year was in 2001. I'm old. Anyway, enough story. Enough about me. So you went to Stellies, and then what happened after that? Where did you do your, what do they call it, an internship?
Internship and community service, yes. So when I finished in 2012, I took the leap and I left my hometown, which is Cape Town, and I went to Pietermaritzburg. And I did my internship at the Pietermaritzburg complex. It was amazing. And then from there, I took another leap and then went to Gauteng and Pretoria and did my community service in Gauteng. Okay. So from Cape Town to Pietermaritzburg to Gauteng.
So you've seen a government hospital in your life?
I've seen it. I've seen the government, the district hospitals, the PHCs, which is the primary health care hospital, everything that you can think of. I've been there.
That is
rural as well.
Sorry to interrupt you. So that is why
Yes.
South African doctors are so popular, because you guys are forged in fire. You guys see the worst of it. I mean, we all know, it's no secret. We struggle out here, and you guys work with some serious trauma cases, serious AIDS, HIV, all those kinds of things. South African doctors see. I actually spoke to a doctor before, and they said that that's why they're so popular. So that because and I've seen interviews on this, because in first world countries there's a lot of these things you wouldn't see, because Australia, when I went there, on the front page news, they were speaking about a guy that was knocked by a bicycle. It was on the news. I was like, that on a Tuesday night, there's stabbings in Joburg Gen. You know what I mean? It's trauma. It's ill. So anyway, so you've gone through the system, and then what happened after that?
Yes, so went through the system, and if anything, I just want to give a lot of big ups to all my colleagues that are currently working there. You know, they work so hard, and exactly that you're saying. It's almost like military, you know, you work with what you got. So I have a lot of respect for all my colleagues in South Africa itself. But once I finished my internship and my community service, I then was working, dabbling a bit in private medicine, and then I went over to the cruise industry and started working on a cruise ship. Yeah.
Okay. How long did you work on a cruise ship for?
For 2 years.
Sure, a lot of experience in very different things. How was that experience different? It must have been you go from
it was an eye-opener.
Right?
It was such an eye-opener, really.
Okay.
And actually you come to appreciate where you come from, because it's first world medicine, you know. You on a ship, you doing US medicine basically, and you need to fit into their way of doing things. But you come from South Africa, where you work with what you got, and so it's actually an easy transition. Because nothing is really much of a challenge there. Everything just gets given to you. However, it does have its own limitations. Yeah,
I can just imagine also, like, going from a government hospital in South Africa where put pressure on the wound to you have headache. How you feel?
Sticks medicine, they call it.
Why do they call it?
Sticks medicine. So you do whatever you can with whatever you have.
Sticks medicine. I have a lot of, like, I've got friends and you know, people I went to university with that are doctors right now. There's even and I bumped into one of them not too long ago, and man, he says it is beyond people's understanding right now in hospitals. They are working crazy amounts of hours, and they are losing colleagues. Like, people are dying. And so if a doctor gets sick, quarantine for 2 weeks, that's a doctor less, or that's a nurse less, or a male nurse less, or a physio less. And so that is why, like, people don't always understand, because we out here, we frustrated and tired, but over there, people are really under pressure. And that's why alcohol had to stop, because it was the trauma cases that they now had to deal with on top of the problems we had, right? And it was that interesting thing about the president showed about Joburg Gen being quiet on New Year's Eve in the trauma unit, which was an eye-opener about alcohol usage. But I want you to, I don't want to belabor all these things. I just want to talk to you about, how did the health hopper come about? What do you do, and how does the whole thing work?
Okay. All right. So when COVID hit last year, they started talking about COVID. I was still on the ships, and then COVID hit and we were in lockdown in South Africa. And it's just when I had returned back from the ships. So I could not go back. And I was left, and I was like, okay, what must I do now? What can I do now? And so I was starting to look into what else I can do as a medical doctor. And then what happened was my parents fell ill with COVID, and I then was tasked, I put it on myself to help them through this moment, because a lot of people didn't know what to do and didn't know who to turn to. And even myself, I felt like I was out of my depths, because there was just information being loaded onto us every day. It was changing. And something just hit me, and the penny just dropped, that there's not a lot of people in this country that have medical doctors or nurses on hand at home, you know, not only when you are in isolation, but just in general.
Yeah,
You know, you have such a reliance on the medical system or on the health system, on the hospitals as well, that you don't know how, it's not close enough for you to get that care, you know. So yes, so that's what happened. My parents fell ill with COVID. I then had to look after them, and thankfully they are well right now. And then I decided that I wanted to bring medicine to the people and make it accessible, make it a quality medical service, and make it affordable as well
okay.
in the communities. And that's where Health Hopper came about. So what Health Hopper is, it's a mobile medical service. And we say mobile because there's two bits to the mobile. One is virtual, so I do virtual consultations. And then another part of mobile is I actually am mobile. I can go to your house and see you at home. I can do a general practitioner's consultation for you in your home. And it's so nice to actually be doing that and to be seeing the difference it's making in people's lives, because it's also it ends up being also very convenient, you know.
Absolutely. I mean,
Yeah.
goodness me. I think of, I come from we first generation, so-called tertiary educated, right? My family, a doctor was like, to get a doctor to your house was, people still tell the story about the time that my grandmother had asthma and the doctor came to the house and they love this forever. And so, and also like the challenge we have, even if you have money in your pocket, even if you have a medical aid in your pocket, right now, my granny used to have, she was in her later years, she suffered from, she was in a wheelchair. So she couldn't walk for long periods of time. So we put her in a wheelchair. So it's a challenge to get that lady out of the house into the car. I used to drive her when I was at university. Now I'm driving her to the hospital. Now, or to the doctor's office. Now, even at a private doctor, the time is never 1 o'clock. It's 1:30. Now you're sitting here with this octogenarian, an 80-year-old woman that has to see this doctor, right? There's a lot happening there. And I mean, the luxury of having a doctor come to your house is like, it's mind-blowing. And a proper doctor with real skills and a very diverse skill set and also experience. That's a huge thing. Because the first thing I thought, I was like, oh my goodness, is she a real doctor? Because I don't, like I go, can she prescribe me medication, like proper, not over-the-counter stuff, the real good stuff, like stuff I need for the So that is it's a huge thing. And so just tell me, with a virtual consult, I just had an experience with Ethan because we were obviously scared with COVID. So we didn't want to take him to because his pediatrician's office is in our hospital. So we were like, I don't know. So we waited a year because he needed his shots and all those kinds of things. Yes, people, we vaccinate. Yeah, we are those people.
Good, I'm glad.
Go in the comments, jy kan maar sê wat jy wil, maar ek vaccinate. And so he had a virtual, now recently we went because we couldn't stretch it out any further, and we went to a place that was really quiet, and his doctor actually had us go to, I'm not going to say what chain it is, there's chains that you can go to and you sit, and there was a virtual consult, and it was the first time I saw how this thing works. It's actually really good because he didn't like, they asked Natalie and me some questions. How is he doing? What is he eating? Da, 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 da. It took like 15, 20 minutes with the doctor on the screen and the nurse next to us, right? First of all, now we're not sitting in a waiting room. Now I didn't have to go to a hospital. So my exposure has dropped dramatically. And when I'm thinking of my 2 to 3-year-old child, I'm very worried. And so then the doctor went, okay, then it seems everything's okay. Weigh him. What's his length? Because the nurse is there. And then the nurse goes, okay, cool. Here's the script. And we had everything there. And I was like, this virtual consulting can work. Because not all of us need to be like, not everyone needs serious attention. Some of us just need a script refilled, and a doctor needs to ethically do the right thing just to check you up. So I think that is one of the things that we want to explain. So just from your perspective, how does that process work with you? If it's completely virtual, I'm sitting in front of my laptop, and here we go.
Yeah. Okay, so I mean, what we get taught in medical school actually, or at Stellenbosch, the train of thought was 70% of your medical consultation is history. That's where you're going to get everything that you need. As long as you're taking a thorough history and you are actually probing into every system, you can start to puzzle piece what's going on, because that's what medicine is, you understand? So you're getting the story. The examination itself is just going to confirm, or it's going to divert you to maybe another diagnosis. So 70% of your consultation is history. The problem is that in our system, we don't have, in a normal system without virtual, you're not doing a long and thorough history because you have too much patients outside. You understand?
Yeah.
So in that aspect, exactly, in that aspect, what you're looking out for is just quick touch, make sure that they're going to be fine, and then you move on to the next person. But with virtual, you're sitting down with your practitioner and you actually have a full-on conversation about everything from the top to the bottom, and the doctor has a full understanding of what the situation is. So how I do it is I'm on a system, an MPS system, which is a virtual platform like this, like Zoom. You can do it on Zoom. You can do it on WhatsApp even now. Even I don't give out my WhatsApp number, but you can do it on Zoom. And then I've got my system, which is an MPS system. So you book an appointment. My assistant then puts you into the appointment log and into my virtual consulting room. And then I will click on you. And this is basically what it looks like.
You just said something that I didn't even consider, but it is golden. These doctors are, even in their practices, they are. Sometimes I've been to every kind of doctor, the kind of doctors that are so like in these really fancy offices, and still there's a pressure. There is another lady outside waiting, or a boy or a child or a husband. And in the more, and I will say it, rural doctors I used to go to, there are literally 30 people waiting. You know what I mean? Half of them want to script because they bubble us, but still there's pressure, and that doctor only has, now it's almost, I hate to say rushed, but there's a sense of urgency in the doctor's mind because she needs to help, or he needs to help X amount of people throughout the day. You can't have those people go home and just now the 50th person you see is like a really bad case and you missed it. And now they have to, so this is actually a much more thorough thing. Yeah, it's actually very thorough.
I feel that it is, yes.
I sense that. Okay, and so the second part of it, when you come and visit, first of all, like, let's just clear this up. What geographical area? Because you're obviously in Cape Town right now. So don't go from Nelspruit because, Yeah.
I don't have a chopper that can take me anywhere. So I've only got my 4 wheels on my car. So yes, I am currently situated and based in the northern suburbs in Kraaifontein. However, I do service northern suburbs and southern suburbs. And it just depends on the timing and the schedule. And we do a roundabout trip from north, south, and all the way up again. Yeah.
Ah, I see. So, and you see also, I just made the joke about Nelspruit, but it goes back to, you can still do a virtual consult. You don't need to see the doctor in every case. So that's a really handy thing. And how many of those do you do on an average day?
So on an average day, we can look at between 2 to 5. Remember, we've just started out, and we're trying to get people used to the idea of virtual consulting and starting to trust the idea of virtual consulting, which has been a challenge. However, that's why this platform is actually so important, to get it out there and let people know that virtual consulting is legit. And it can be done, and you can get proper care from a virtual consultation.
Yeah. So another thing I wanted to ask you, how many of you are there? It's you and?
So it's me, and then I do have backup doctors as well that are on our system to do virtual consulting. However, because it hasn't picked up as yet, we are on like a standby. And then with mobile right now, I'm doing mobile by myself. And as the demand increases, I will definitely be getting on quality doctors, because we are busy in the interview process. So watch the space. And then we'll be able to service a lot more. And that is what we want. We don't want to compromise on quality. So therefore, we have to take it step by step.
Yeah. Listen, I think it's a great thing. Honestly, I think that, and also just like you said earlier, it's not people here, virtual consult come to visit. Of course, there's costs to these things, but like you said, it's not chaos. It's not crazy. And I think it's a very valuable thing. In my mind, it makes complete sense. And I've got a suspicion you're going to be a little busier right now. I applaud you. Number one, is there anything else that I didn't cover, that I didn't ask, that you think is important to share with the people?
Yes, there is something that's on art with regards to COVID. I mean, there's a lot of people that find that COVID, it hit us all for a six, basically, and it really it depleted us in our energy as well. But something that COVID has made me realize, just as a medical doctor, is that even though in our past we were divided as people, right now what COVID has done to South Africa itself is that it's made us realize that we actually only one body. We have one body, we work the same, no matter who or where we come from. There's only one fundamental thing for us to do in order to get over this COVID, and that's to realize that we need to look after ourselves and we need to look after each other as well. And that I am here for that, because it's just showing us that we can do this and we can get through anything, a pandemic. It doesn't matter what.
I couldn't agree with you more. I'm gonna tell everyone. I wasn't gonna share this with people, but I feel like this is the time to say it. Both Natalie and I did have COVID. People didn't even know we had COVID. We were isolating, and we were so careful. We were so careful. But unfortunately, we have a suspicion where we got it from, but that's not the important part. Is that we were lucky and we got through it. But let me tell you, I was very ill. I was very ill, and I was making videos where people didn't know I was very, very ill. I would put the camera down and go, God. Like I couldn't walk from the bathroom to the bedroom. It felt like I was running a marathon. I was extremely, and everyone thinks that they're asymptomatic. I'm sure I've had it. I was like, no, you treat it like you've never had it. Asymptomatic people seem to me, I'm not a professional, to be very rare actually. I thought I was this asymptomatic person. I was like, no. I was not asymptomatic. Me and Natalie were sick. It happened in October of last year. It was horrible, right? It was 2-3 weeks there were 4 days there where it was bad. But I never had to go to a hospital, luckily. I just got the diagnosis and I stuck to it, and we stayed in the house. And the reason I never shared it was, because I have this platform, I was struggling with, do I tell people the experience of it, because that's important? But I was like, I felt like everyone was sharing that experience already. So many people understood what it was. It was all over the news, and I was providing like a little bit of levity, to people's lives. And I was like, I don't want to bring this horror story at the moment. Not a horror story, but the heaviness. I'm here to make people fun and happy and laugh. And I just thought, okay, unless this thing turns really bad, then I'll share it. But I felt like sharing it right now would psychologically bring people down. It was like, oh my goodness, this guy that they're so happy all the time, and now they're sick, and what's going to happen? I didn't want that. So we never spoke about it. And also back then there was a little bit of a stigma. I saw it with my friends in Hanky, my parents. It was like people weren't sharing that they had COVID. And I was like, oh my goodness, maybe I should say something, because it's a disease that we are all getting. I don't understand the stigma around it. You get over it. I've been over it. We're fine. But yes, it made me recalculate a lot of things about my health and the value of my health. Because I was sitting here thinking about, where am I going to make my income from? Can we pay the bills this month? And then bang, my family's sick. And thank goodness my Ethan, we tried to isolate from Ethan. So we're in masks the whole time in the house. We're putting Ethan in a different room. But lucky for us, he seemed to be strong. But yeah, we all got sick. And I really wish I had a health hopper to come, because I really needed a little bit of... It was also like I needed emotional support at some point. I was not well. Natalie was not well either. My wife's very strong, I must say. But we were struggling. But anyway, that's my long story. Thank you so much for coming on. I'm going to leave all of your details, you've got a Facebook page. I'm going to put your email. I'm going to put all the details onto this video. And if you guys want to chat or have a virtual consultation, then you guys know where to go. Thank you so much. I think this is a fantastic service. I wish you well. And I hope it grows from strength to strength. I'm sure it will. I've got a feeling it's going to be a very big thing going forward. But anyway, thank you, Dr. Jones.
I really appreciate this platform, Alfred. Thank you so much.
Okay. Ciao. Have a lovely day.
Bye, you too.